Tell me, first of all, how optimistic you are about this pandemic at this point. We're now over a year in, basically, for the US anyway, in terms of our being thoroughly aware of it going on. Are we at a worse place than you expected a year ago, or better, or roughly where you expected?
At the moment, I'm revising my expectations in a more pessimistic direction. But even where I was a few weeks ago, um, I wouldn't have been happy a year ago if if you had pulled me aside last January and said, we're still going to be losing a few thousand Americans a day. There are going to be hundreds of thousands of new cases every week. Um, and we're going to have vaccines. That's miraculous. But we're going to be facing really significant skepticism in the population of those vaccines. That is going to really, if not prevent, then complicate our efforts to get to herd immunity protection through a combination of natural immunity and vaccine immunity. You know, Depending on exactly how infectious we think this disease is, experts now think that we'll need to have immune protection in at least 70% of the public and maybe as much as 90% of the public before the disease can really die out. And if we have, 37% of nursing home workers who've been offered the vaccine have taken it, which means that 63% of those who've been offered the vaccine working in nursing homes, seeing the ugly face of the disease firsthand, have refused it. I think we have a real problem on our hands. I think I've been looking forward to the rollout of the vaccines for a while, thinking that it may take a while. It was going to be slower than we had hoped, but the development was so rapid, and it really would play the role of miraculous Deus ex machina here. And I'm worrying for a number of reasons that that timeline is going to be much longer than I thought it would be just a few weeks ago. So one reason for that is, skepticism about the vaccines, which is much larger than I would have thought a few months ago when there were stories published about vaccine skepticism. I thought when push comes to shove and those drugs are out and available, then people will take them. We've lived through this brutally horrific year. How could you not take them? But the other thing that worries me is these new variants. We don't exactly know the nature of each of them. We haven't sequenced the genetics of them all that successfully. We haven't watched them in the wild all that well. We know a little bit more about the British one than the South African one, and a little bit more about the South African one than the Brazilian one, and a little bit more about the Brazilian one than the Californian one. But all of them seem to be challenging some of the basic assumptions we had about the nature of the disease and the near future of the pandemic. And the one that scares me the most is the Brazilian one, and that's because it arose in Manaus, which is a city in the Amazon. Incidentally, it's a place I've been. I've also been to Wuhan. I've also been to Lombardy. I feel like I'm like patient zero in this whole pandemic. But
can I stop you right there for a second and just let's start with that first point you made, which is these. I mean, when I think about vaccine skepticism, I have a real hard time wrapping my mind around it. I think partly because I've always had basic confidence in the medical and scientific establishment. And I also learned during the AIDS epidemic who to trust, how to read studies, how to think seriously about this. But this particular question, why would people not, after a year of lockdown, loss of income, stress, fatigue, terror, death, would they still say, I'd rather not? And as you said, this is from healthcare workers who are the most upfront exposed to the people dying of this. So if that doesn't scare people, what is it, David? What is it in the human mind that is resisting this?
I think we're really scared of novelty. I think in general, I think you could look at the pandemic that way too. There's a way in which, looking back, we may have overreacted in the spring because we were so scared of a new disease. I think at the moment we're now taking the opposite approach and underreacting. But I I think that in general, we're really, really scared of new stuff and really comfortable with old stuff, even if the old stuff is really brutal and ineffective and, problematic.
In
I think that,
France, it's like in France in particular, it's through the roof, right? I mean, it's like half the country won't take the vaccine, which is surely at some point governments are going to have to say, look, we can't begin our economies, we can't get anywhere if we don't get more people vaccinated. Now, that's going to be a very tough decision, presumably.
yeah, and there probably will be employers that require it of their employees even earlier than that, and then I'll get into a lot of you know, health privacy laws that we haven't sorted through here either. I think it's going to be pretty thorny, and the easiest solution is that the public takes up the vaccine very casually and comfortably and without opposition. But that doesn't seem to be where we are. And when you look back to, there are all of these stories about mid-century vaccination programs in the West that are incredibly inspiring. In New York City, in a period of 2 or 3 weeks, in I think 1947, we vaccinated 6 million people against smallpox in response to a smallpox outbreak. 6 million people in just a few weeks. And the polio vaccine was sort of celebrated all around the country. People were out in the street waiting for their vaccines, lining up around the block, no resistance, no skepticism at all. And that's kind of incredible considering that vaccine technology was pretty new at that point. We're now, theoretically, we're benefiting from 3/4 of a century of familiarization, normalization, routinization of vaccines. Almost everybody gets them in early childhood and gives them to their kids when their kids are that age. You'd think that we would have grown much more comfortable, but it seems, at least in the face of a novel disease with a novel vaccine response, the opposite has happened. And ultimately, I don't want to offer any strong hypotheses about why it's happening. I honestly don't entirely understand it either. That people say, well, there is this, especially among Black and Latin communities, there's a sort of skepticism of the medical establishment going back to, the Tuskegee experiment, which is, totally legitimate as a sort of historical, that happened. That's scary. But this is not a vaccine that is being rolled out in an ethnically targeted way. It's being rolled out, for the most part, to the population as a whole. You'd think that those hangups would disappear. You'd think, especially among medical workers and health professionals who had seen the face of the pandemic up close, that they'd be especially eager to turn the page on that.
Or those communities that are disproportionately likely to have to work around other people, who have to take public transportation, who are poor, who are having to be out there, can't afford to stay inside and be more protected. They paradoxically seem to be among the most resistant to taking the vaccine.
You can understand that to a certain degree, because these are people who've figured out how to live under these conditions over the last year relatively well, whereas people like you and me, who've been mostly living in our little bunkers, are probably eager to get out and live a little more freely. And so there is a kind of a social and psychological training that's gone on, where people who are on the front lines have probably started to understand the disease as a manageable threat, as opposed to a kind of an existential threat. Whereas those of us who have been more protected all throughout are a little more desperate for relief, because we've been taking such extreme precautions.